So definitely we want to dive right into all of it. So we've kind of front loaded the agenda with some of kind of overarching themes that impact everyone as part of the initiative. And then we're going to save some time at the end for kind of a quick round robin for all the states that have active legislation to kind of celebrate the wins that you guys have experienced and continue that knowledge sharing. But as many of you have probably experienced from kind of testimonies perspective, we're going to limit you to 2 minutes, not 3. So make sure as you're preparing what you're going to say for that you limit it to 2 minutes or less. I'm not going to have a light or anything like that, but be prepared. So the first issue that we're going to discuss today was something that was brought to us or flagged for us by the Office of Superintendent of Insurance in New Mexico. And that was in regards to an age discrimination issue that there was a concern that if a bill is limiting ages, that was a form of discrimination under the Affordable Care Act. And so we had Peter Thomas and Hannah, who's on the call as well, dig into this from Powers law firm and do an analysis on this. So I really want to kind of share, kind of send the mic over to them and really have them dig into this. And right before this call, I sent out the memo that they prepared so that you guys can read that in full, as well as some kind of frequently asked questions that might come to mind. But without further ado, I'm going to hand it over to Peter and Hannah, and you guys have about 15 minutes for this.
All right, great. Can you hear me?
Yes, we can.
All right. Well, let's start. The Affordable Care Act, which was passed in 2010, does have some provisions that relate to non-discrimination in healthcare, and they're important protections because the first time, other than 1997, when Congress passed the HIPAA legislation, that non-discrimination based on health status was extended to individual plans. It used to only, HIPAA really only applies to group health plans. So they also have, so there's 2 sections of non-discrimination language in the ACA. The first is section 1557, and that is a very generic non-discrimination provision based on all of the federally protected categories of discrimination, including age. And then there's another section based on the benefits package, the essential health benefits package, that also talks about age discrimination and how you've designed your benefit plan, the package that you've put together for coverage. And it says in there that you can't discriminate based on age. So there's 2 spots in the ACA. The most relevant provision involves that benefit design piece, but that was not regulated until last year. And last year, when the Biden administration came in, and the first time they took a look at those regulations, they decided to implement some additional protections. And those protections basically state that if you've got a benefit that is generally beneficial to all ages, that really you can't limit it to a particular age group. Am I still coming through? Can you hear me?
Yes, we can still hear you, Peter. We'll just ask that if anyone has some kind of noise going on, if you can just mute yourself, that'd be great.
So this is the language that the New Mexico Insurance Office pointed out to us. We went back and researched it. We took a close look at it. Hannah did a deep dive into it. And what we found was that, in fact, that is correct. You really cannot limit a benefit to a specific age category. Now, of course, it's designed to try to prevent, plans from limiting certain benefits, typically to people of older age, but, it just equally applies to younger ages as well. And so, New Mexico's insurance department was right. However, there is an exception to that. And that is where you've got an evidence base where you can demonstrate that an age distinction is relevant, appropriate, justified by the evidence. And if you can demonstrate that, then that's an exception to the overall rule about not being able to discriminate based on age. Now, don't get me wrong. We don't want to discriminate based on age. It is not our desire to limit this benefit to kids, whether you define that as below 18 or below 21 or below 26, which is consistent with the Affordable Care Act extension of coverage for people under 26 who could stay on their parents' insurance until that age. But there are some states that we are not going to make headway in. They're simply not going to adopt this bill unless we find a way to limit it and limit the cost to children or to kids, young adults, who really, when they're growing up, there's a compelling reason to allow them to have access to prosthetics and orthotics that allow them to participate in activities, sports, athletics, fitness, along with their friends and their peers. It's an extremely important aspect of growth and maturity and development, not just physical development, psychosocial development, leadership, the whole thing. So I think we came to the conclusion that we can have our cake and eat it too. If there are states that really want to push for coverage of all ages, we provide them with the background and the legal reasoning that states, you can't limit it to kids. You have to apply this to everyone. And therefore, that is the proposal. And if they can get it through, that's fantastic. If there are states that say, look, we're not going to be able to get that through, it's just not going to, it's a non-starter. It's going to cost too much money, or it's just not going to be accepted by the insurance companies, and they're going to fight it tooth and nail. But if we can limit it to kids, obviously you've got the empathy there. You've got the heartstrings argument. We think that there is enough evidence base just in the research that we did. And I know Susanna Engdahl is doing some additional research in this area. But we did do some research to try to establish an evidence base. And I think there's plenty on which to rely to make a credible argument to a state legislature or an insurance office that, in fact, there is a tie to youth and this benefit. There's the whole obesity issue and what some would call an epidemic amongst youth. There is all of the sequela, all of the conditions that flow from that. There's all kinds of issues involving mental health that we could tap into. So there's research that says that if you're active and engaged in sporting activity by age 12, that you're likely to do that at later ages. If you're not likely to do it at later ages. So I think there's enough. I wouldn't want to publish an article in the New England Journal of Medicine on this, or I wouldn't want to go into court and argue that this is a slam dunk and there's no question. I'm not saying this is a foolproof slam dunk case, but do we have a credible evidence base to make an argument that this can be restricted appropriately and within the confines of the Affordable Care Act to people below 26, 21, or 18? I would say yes. And we've come to that conclusion. And so I think we really have an option for states and the advocates in those states to choose whatever they think is going to have the best chance of getting through and getting enacted into law, that they can have their choice. And we'll provide them with the argument to make those the case. And then, of course, you build on that, right? First, you get your foot in the door, and then you build on that going forward. Now, if in fact, one last thing, and then I'll stop talking and pass it to Hannah to see if there's anything I missed. If in fact they do pass a bill like they did in Maine, that is restricted to kids, and it's challenged legally, what's the likely scenario for how that would be challenged? Well, they're certainly not encouraging the states to adopt this. They'll sue the state. They'll sue the insurance department. They won't sue us. They've got no claim against us. And by us, I mean NAOP, AOPA, the Academy, AFT Coalition, any of the state-based advocates. They have no way of putting us in a lawsuit. That just is a non-starter. But they would sue the state, or I should say they could sue the state. If that were to occur, my guess is that there would be a settlement. And the settlement would likely result in the state lifting the age limitation, but continuing along with the benefit. Similar to a judge that would decide that case if it wasn't able to be settled and it went to court and a judge had to decide. We have evidence of this in New Mexico, where there was a hearing aid benefit that was limited to children. There was a suit brought. The judge struck down the age limitation and applied the mandated benefit to the entire population. The likelihood is extremely high. I would say it's 100%, but it's very high that that's what a judge would do in this scenario as well. So, maybe it's a little bit squirrely to go in that way, but frankly, at the end of the day, we achieve our victory. So that's pretty much where we are. Hannah, what else could you add? What did I miss?
Hi, Peter. Hi, everyone. I think that Peter did a good job of explaining the practical implications of this. Nicole, were you able to send out that memo that we put together?
Yes, I sent out
Okay.
the memo, and then in addition to that, some FAQs.
Perfect. That's great. So if you want to get more into the weeds of how that works, I think that memo does a good job of explaining it. But what I think matters for right now is what Peter was explaining of the practical implications for everyone, and then the FAQ is great, and we can also work to kind of condense that information down into just the practical implications as well, just so we're not in the weeds with all of the details. But no, I think, Peter, you did a great job of explaining just the practical impacts of this. So yeah, and we're also happy to answer any questions at any point as well.
Great. Thank you both Hannah and Peter for your work on this, and to NAOP as well as our partner in this initiative. This has been really helpful to dive in. I know this was probably very much in the weeds for all of you, but something that we wanted to make sure that you are all aware of. And as we're moving forward, kind of, I guess maybe your question might be like, well, what does this mean for me, or what does this mean for my state? Not a lot is changing in the sense of our current strategy. Like, we still want to go for all ages when we can and drop back down to 26, 21, 18 if necessary for your state. So that's something to kind of consider as you move forward. Broadly speaking, as an initiative, we want to try and get this passed in as many states as possible. And so we're just developing the resources that would allow us to do that in some states where maybe 18 or under is the only option that they might do. So I think the analogy was like getting the camel's nose under the tent. So I want to open it up. Does anyone have any questions on this that we can answer for you?
Hi, Nicole. I have a couple of questions, and I think this is probably more of a breakout conversation between Peter and our team in Colorado. But mentioning literature potentially being published, we do have our fiscal and social report currently going through a peer review process with an international journal, and I just want to put that on his radar and talk out what that could mean. Make sure that we're crossing our T's, dotting our I's, and doing things properly if that needs to be held for whatever reason. So Peter, feel free to reach out to me. I'll send you my phone number and my email in a chat.
Great,
Please
thank you.
send that to Hannah as well, if you don't mind.
Yeah,
I
I'll
have
put
to be
you
in
to.
a car right now. Just
You
want to
got
make sure. And
Thanks.
maybe Nicole, can you give is Susanna on the phone by any chance?
Yeah, I am.
Okay, there you are, Sienna. Thank you.
Susanna, we sent over to you just some of the research we pulled together, but do I have that right, that you're poking around to see what else you can find, or did I get that wrong?
Yeah, it's on my list. So yeah, I'd be happy to be looped in on any resources that others might have found.
I'll send Susanna, you, Peter, and Hannah our current report that's going to go through that process. It's currently underway, and then I'll include my contact information.
Great,
Well,
thanks, Eunice.
if it's a time sensitive thing where you need a 1 or 2 pager on the list of citations to what we can quote, I haven't done what they typically do with this. It's something that Susanna is an expert at, which is going through the literature and then writing up a couple of paragraphs with citations. We haven't done that, but we have found some studies that we think could be helpful to proving the case that there is an evidence base for limiting this to kids. And we'd be happy to share that with you in draft form as Susanna continues to develop that.
Great. Thank you, Peter. And for those of you who don't know, Susanna, Dr. Susanna Ingdahl is my colleague at AOPA. We're super excited to have her. She's our manager of health policy and research. And so she's going to be helping out with this kind of evidence base for those states who might need that. Great. I want to keep us moving along on our agenda. So the next topic that we're going to dive into, and if you do have any additional questions on the age discrimination piece, please feel free to email me about that and we can make sure to direct it to the appropriate person. So the second piece that we want to talk with everyone about is a little lighter, a little more fun because it involves branding and all of that. And one of the things that kind of has come to our attention is that potentially So Kids Can Move has become a brand that's a little bit confusing. And it ties well to the age discrimination piece in that sense, where is this just about kids? Is this about all ages? That's something that we've kind of heard from individuals and have had to answer. And I think, Jeff had a great analogy on a call that we were on this morning that in many ways, So Kids Can Move has been the propellant to kind of get us off the launch pad and kind of building our rocket, but that our vision for this is much bigger. Like we're heading to the moon with who we want this to cover and not just kids as part of that. And so in order to kind of signal that our vision is much bigger than this, we're thinking about transitioning the name of the brand So Kids Can Move to something that's more encompassing. And that's kind of where we wanted to get some feedback from you all on today. I don't have a presentation to share of the exact brand, but the name that we're thinking of is So Every Body Can Move. So moving it to that. And we would be either internally working to update that brand or working with some brand experts to kind of re-envision what this looks like. But for now, that's what the name would be. So Every Body Can Move, and really felt like the word body would help us even in a better way symbol that this is about the disability community. I don't know if any of you guys have heard the phrase from Nike of if you have a body, you're an athlete. So it's definitely in alignment with that. And it would just be an opportunity for us to signal this initiative to companies, corporations, and other organizations that it's about more than just children. So that's kind of the first piece of this that we want to get your feedback on. The second piece is acknowledging that we want a goal, we want a vision, we want something big that we're all working towards. And that's something that's going to be able for us to kind of get some fundraising partners behind. So many of you have sacrificed your own time, your own funds to kind of get this off the ground. I really see this group here today as really the early adopters, the pioneers of this initiative. But we know that we need to bring in funding in order to make this initiative continue to grow and to continue to have the momentum that it's had. And so with that, one of the concepts that we have created is a fundraising goal initiative that we're calling 28 by 28. And what that means is that we want to get this legislation passed in 28 states by the LA 2028 Paralympics. And by tying it to the 2028 Paralympics, that really offers us the opportunity to tie it to one of the biggest disability movements in the world, the Paralympics, as well as being able to capitalize off of a lot of the energy and corporate sponsorships that come in through the Paralympic and Olympic movement. And it would also be a signal that once we get past 28 states, this is something that we could bring to the federal government for nationwide reform. And this concept, we've been developing this in partnership with Kyle Stepp, who I'll share is now a consultant. In addition to his work in New Mexico, we're bringing him on board as part of this initiative as a consultant and his background in developing kind of national, international partnerships and fundraising. And Kyle, I don't know if you want to share anything about kind of this vision with 28 by 28 as well, but I'll open it up to you to share for a couple minutes.
Absolutely. Thank you, Nicole. I think one of the most effective parts of this initiative has been the local efforts. Because in order to make this coalition, in order to make this movement possible, it's the local stories. By no means, if we would have came in and said, you know, every single state has to do so kids can move, I don't know if that would have been effective if we only saw and heard stories that are national stories. But because we have our stories that are so hyper local, whether, you know, it's little Braden from Colorado and his background, or it's the families in Oregon, I think that's going to make this so effective, but also showing that this is a national movement. And I think from a background of fundraising, this is going to give us a really easy call to action and really measurable way to bring on strategic partnerships so that they can see the progress towards their investment in this effort. And so I'd love to hear everyone's thoughts on this concept and get your feedback.
And real quick, before we kind of open it up for feedback, I want to poll. We can do polling within Zoom. So if Joy, if you can launch this poll, basically we have, I think it's 4 questions for you to fill out in terms of, you know, do you feel the current brand is confusing? How do you feel about a rebrand for the initiative? How do you feel about the So Everybody Can Move proposed name change? And how do you feel about the 28 by 28 goal, vision, and campaign concept? So if you can, we'll just take a minute for everyone to fill this poll out, and then we'll be collecting those responses on the back end here. And Herb, yeah, feel free to ask your question or a statement.
Yeah, so, well, the question about, I guess I get 2 questions now, one for Kyle and one for the survey. I'm confused enough and not sure enough that I'm not, yeah, so I guess you have choices like unsure, unsure, unsure. Yeah, I guess that's the way I'll vote because I'm still not sure.
And yeah, that's absolutely fine too.
Yeah, and for Kyle, this is sort of on the sidebar. Hey, Kyle, I hope you did well with your recent competition. And I hope that you will have time soon to get around to my request that I made to you a week or 2 ago. Do you recall?
Yeah, absolutely. We were waiting on the final legislation coming from New Mexico. And I know that's the piece you wanted, was all the details from New Mexico. They're finalizing the bill. They finalized it. It'll be early next week where it's packaged. And I can get you all of those additional pieces that came from our team.
Many thanks.
Awesome. We'll give everyone about 15 more seconds to get your votes in, and then we'll end the poll.
Cole, can I just respond to that for a moment?
Yeah, absolutely.
I'm sorry, where was the question from? What state?
Question about what?
Herb is from
Okay,
Connecticut.
that Kyle,
Oh, Herb.
Kyle just answered. It was Connecticut.
Oh yeah, Herb is from Connecticut.
So I'm not exactly sure what you're planning and doing in Connecticut, but just know that, you know, New Mexico is one state, and New Mexico had a very engaged insurance office and inserted a number of provisions in the bill that many of which I liked. A couple I have more significant questions about, but we took their lead. That's what they wanted to do, and they went well beyond the model legislation. I don't know what your situation in Connecticut is, but every paragraph you add, every new concept you include, there's a number of provisions involving non-discrimination. There's a number of provisions that link to the Affordable Care Act. It makes it more difficult to understand. It makes it more challenging to get consensus and buy-in. So just know that when you look at the New Mexico language, I want to just make it clear. I don't view that as a model bill right now. I mean, I think the model bill was drafted a couple of months ago, and that stands as of today. Doesn't mean that we're not open to whatever needs to be done in each state to get this passed, but just keep that in mind as you look at that language, if you would.
Well, thank you for that, Peter. And no, I'm not sure I have the language of the model bill. And the question that I had for Kyle really was the language that was used to address the actual cost per member per month that they're going to talk about. Well, of course, under the ACA, what's it going to cost the state to implement this? And I thought Kyle had language that would address that. So that was the question to Kyle a couple of weeks ago after the most previous call.
Okay, that's a really important issue, the issue of defraying the cost, whether the state has to defray the cost. Kyle, I want to mention something about that real quick. Nicole, forgive me for taking over here, but
Well, that's fine.
does the New Mexico language address that specifically, Kyle? Kyle,
Sorry, Peter, you cut out with your question, I believe.
I'm sorry. Does the New Mexico language specifically address the defrayal of cost issue?
Kyle, are you able to respond? I'm not hearing
Well, I
anything
okay, I
from
don't hear
Kyle's side,
anything, so-
but to answer that a little bit, yes, that was the goal of the Office of the Superintendent of Insurance, was to get around the cost defrayal piece of the bill.
Right, so any language around that might be helpful to you, and that's great, because apparently in New Mexico, it did the trick. I don't think we should look at that necessarily as, again, the model for how you go about ensuring that states don't need to defray the cost. My argument to this is that this is part of the essential health benefits package under rehabilitative and habilitative services and devices. There's legislative history that includes orthotic and prosthetic care under the definition of that term that is in the ACA's essential health benefits package. The argument is that insurance companies should have been providing this all along. This is really just a new viewpoint on medical necessity, on the concept of medical necessity. It's not a new benefit. It's not really even a new mandate. It's really an interpretation of the breadth of orthotic and prosthetic coverage. And I liken it to durable medical equipment or wheelchairs, where in many instances, specific brand names or types of wheelchairs are not listed in benefit packages. They cover DME, and if a person needs a particular type of wheelchair, it's based on medical need. And that's exactly what we're suggesting here. But again, if Kyle's language can be helpful, then have at it. That's great.
Nicole, do you have the model bill language that has been
Yeah.
distributed?
Absolutely, Herb. And that is something that we will provide you guys. We've been a little bit busy with the active legislation, but that's, and you guys, and kudos to you in Connecticut, you guys are hitting the ground running. We were not expecting you guys to be moving so quickly, but we will absolutely get that over to you to help.
I don't know how quickly we're moving, but we're trying to do our homework before we start moving.
Absolutely. And I will, in Shanice's part, she will address a kind of fiscal and social impact report document that she's brought up or has created for Colorado and has offered to help in other states. But I will leave that to the kind of that portion of the agenda. We'll make sure we get those things answered for you, Herb. I do want to bring it back to the kind of rebranding, and thanks to everyone who filled out the poll. Jeff, thanks for patiently waiting with your hand up.
Thanks, Nicole. I love the 28 by 28 concept, as long as we clarify that if a state currently has a mandate, I think the goal is to add activity prosthetics. If a state doesn't currently have coverage for a standard prosthetic, the goal should be coverage for a standard prosthetic and an activity leg. I hope that would be clarified.
Absolutely. Yes, we can clarify that. And that was part of the vision, is that this would include the insurance fairness piece. So if there are states that don't have that would, for example, like in New Mexico, has that and the physical activity piece. Great. All right, Joanne.
Thank you. So I like the visual of 2028, but I do have some concerns. You know, the visual of a Paralympian is great. People see that on TV, but but and providing kids and everybody, you know, with high activity devices will produce Paralympians, but it's not really the goal. Our goal is to get everyone recreationally active and all of the benefits. So I have some concerns with high activity means Paralympians, because a lot of people are never going to be Paralympians, but they still deserve this componentry. Those who are elite athletes are getting their componentry now. You know, it may be difficult, but they're getting them now. We want them for everybody who's people are never going to be Paralympians. And that, I guess that's my concern.
Yeah, 100%. I mean, we are absolutely in agreement with you that access to physical activity is for everyone. And that's really the way that we've been framing the initiative with so everybody can move. The opportunity to pair this with the 2028 Paralympics would be a much kind of more nuanced part of our messaging, and to be able to kind of be able to go after the Paralympic and Olympic brands and corporations that are sponsoring that, to get them to sponsor this as well. But absolutely, we're not changing our messaging in terms of access to physical activity. We're not changing it to say like access to the Paralympics. It's really about access for physical activity for all. And in our materials, in our branding and all of that, that'll still include children in it. It'll still include older adults. It'll include activities such as walking in addition to running as well, and playing on the playground or things that are outside of competitive sports. But definitely want to continue kind of having that conversation together, because if you feel like that's something that we're going too far in a certain direction, definitely want to make sure that we take the right steps so that we're not, you know, pigeonholing ourselves in any one way. But really, so everybody can move is something that's going to be targeted at the legislators, state-based advocates, people on the ground. And this kind of vision for 2028 would allow us to go after some of these corporations that typically sponsor the 2028 Paralympics and Olympics. Great. Happy to follow up on that if you have any additional thoughts. And Ryan.
Hello?
Hey, we can hear you.
Oh, sorry. I don't know what just happened there.
Oh, did you raise your hand?
Hello?
We can hear you.
Oh, sorry. I don't know what just happened there. Anyway, yeah, I mean, you know, and for those of you that don't know me, my name is Ryan Getty. I'm a government relations specialist at the Amputee Coalition. And, you know, we were just having a conversation about something very similar to this yesterday, whenever we were talking about how something for our national conference and the idea of bringing in Paralympians was brought up. And we absolutely want to do that. But the problem is just like was said, you know, not everyone's going to be a Paralympian, right? Not everyone wants to be a Paralympian. But I think for this campaign, the way I think about it is kind of, if anyone remembers like the NFL, like Play 60 campaign, you know, like that was like an NFL campaign, which is a professional sports organization, but they don't do that with the intention that everyone's going to be an NFL player, right? They do it because, you know, it's great optics, and it, you know, it's these people that are at the top of their game, basically saying, you know, being active is important and good. And they don't necessarily mean competitive sports. They just mean, you know, being active even at all. And I think what, who said that in the chat? I think what Jeff Kane said in the chat about, you know, high activity for some people might just be getting up and going to the grocery store. I think that's absolutely something that we need to keep in mind. But I also think that using the 2028 Paralympics as kind of a measuring stick and an opportunity to increase engagement could be a great opportunity. I think there's no reason to pass that up.
Absolutely. Thank you, Ryan. Cheryl?
Hi, so I'm definitely probably the greenest person on this call, but just in hearing what everyone's saying, I agree with the activity, but just from my sense, and I think Ryan kind of hit it on the head, that if you're able to link it to something to increase awareness, as long as you don't lose what the initial message is, I think that with this being such a grassroots campaign, that the larger the community that we can reach and the perhaps like more prominent voices that we have, I think could be really beneficial. So I think that as long as the initial reason why this is happening is still the foundation, it doesn't hurt to perhaps have some larger voices to help us to reach those goals.
Absolutely. Great point, Cheryl. And thank you for sharing that. Something I want to address as well. You know, the Paralympic movement is not just about sport. It's also about disability awareness. It's about disability rights. So when we're talking about the Paralympics too, we're also connecting ourselves to that, not just the sport side of it, but the disability rights side of it as well, and bringing visibility to disability. So I think there's definitely an opportunity for us to kind of tread that line between making sure that we're talking about physical activity for all in every form that that looks like, while also tying us to an incredible movement for disability within this country.
Could I quickly say something, Nicole?
Yeah.
This is Peter. I've heard the term high activity a couple of times. We're actually not using that term, just to clarify. We're using activity specific, which is, I think, a very different concept. So just want to make that clear.
Great. Thank you, Peter. All right, well, if anyone has any additional thoughts or feedback that they'd rather share, you know, via written in the chat, feel free to do, or email me as well, and we will keep you posted as we're continuing to discuss this internally, and then we'll share with you all our kind of pathway forward.
Well, I'm sorry for interjecting again, but let me just say, I'm one of the people who put down, I'm not sure whether we need to change the name, because I do think that leading with kids does have an empathy factor to it that gets people's attention. I mean, making the case through kids in terms of activities that they want to participate in with their peers is a pretty compelling message. And then if it gets expanded from there, all the better. But I must tell you that whoever came up with so every body can move, I think that's pretty clever. I like that. So I'm certainly open to it. Just wanted to take that.
Great. Yeah, thank you, Peter. And I think that is definitely an important distinction to make as well for the group, and really highlight our strategy of making sure that kids are involved in this process, no matter what that looks like. And I know New Mexico did an incredible job at that. Even though they branded themselves as So New Mexicans Can Move, they absolutely put children such as Callaway and Hope, you know, front and center in that process, and made sure that their voices were heard. And that was definitely very well received. And Colorado has done the same. So that's, you know, something to consider, that even if the brand itself does not have the word kids in it, that there is absolutely still a way to include children in the narratives, in the testimonies, and in, you know, whatever materials that you have that you're delivering to legislators. Great, thank you guys. So we're gonna take a look at the poll results and be discussing this internally kind of as our initiative partners, and we will report back on kind of pathway forward. And again, if you guys have any strong opinions or thoughts on that, please email me and I will be sure to read through those and respond to you as well. So the next section, to kind of keep us moving along in our agenda here, Shanice, want to give it over to you to kind of share at a high level what you've been doing with the fiscal and social impact reports. And if you could limit to about maybe 3 or 4 minutes would be great.
You got it. I don't want to bore y'all too much with data anyway, but we all know data makes the world go round. Everyone that doesn't know me, my name's Shanice Kehoe. I am currently working in a public health leadership role for the state of Colorado. However, my work here is not by any means in support or representing the state of Colorado. I have to say that legally, but you know, my role prior to that, I am an ABC board certified clinician. I've done a lot of work in the pro bono nonprofit space with Range of Motion Project, and I've also overseen population health programs on a health leadership level at a community-based hospital. So my background has helped me in a really unique way prepare this report. I've also been in contact with a lot of folks in a professional sense, whether that's physicians, PhDs, and of course through Nicole's team to help review our content to make sure that it's making sense and it's representative of what we're trying to get done here. And that's really projecting the cost of what the per month per member would be at the state of Colorado. How we've done that is a very lengthy methodology, but it's actually somewhat simple. And I wanted to share the opportunity to offer the same service to other states. We're currently working with Illinois. We started to help with New Mexico's their cost estimate. However, with that being said, I think that they're well underway without the need of it. But Kyle, if you ever need it, you can still offer it. And I'd really like to extend the same to anyone here. So really what that means is I'm going to share a link in the chat, and this is a draft of ours. It's currently being peer reviewed by the European Journal of Medicine. It's an international journal that reached out because they're looking for initiatives that are talking about public health access and equity, and they're really excited about what we're doing. Any initial questions on kind of the purpose of this report that I mentioned? I know I can spit a lot at you, but happy to answer some initial questions.
Thanks for
Shanice,
dropping
I think
that into the chat, Shanice.
Shanice, I think something you did extremely helpful for New Mexico is can you walk through the key stages of how, in a high level, that you helped me understand the per member per month? Or before I got kicked off, that's what I was trying to share. It's Shanice is the expert who created that. The only way I was ever able to get an understanding of our per member per month is because we don't have the infrastructure, is this initiative that Shanice did. But if you don't mind, you made it extremely helpful for me.
Yeah, no problem. So essentially our methodology is based off of an approach that, one, we want to try and get actuarial data that's relevant to the state. In Colorado, we have a Senate Bill 40 that's unique and not many other states. In fact, I'm not sure if any other states have it, but I can't clarify that for sure. That requires us to pull actuarial data in order to project these costs. We've attempted to do that, and it was a lengthy, expensive process. And there's some nuances there that I'm not going to go too much into detail, but essentially we're needing to validate the data that we were given by the payer claims database in Colorado, because we have some concerns that it's not comprehensive. So when we went to the Division of Insurance with that information, what would an actuarial do if that was the case? Well, like any peer review or fiscal type of analysis, if the data isn't available to you in the current state, you can use data at other states or at a national level to do an analysis if that data is reputable. So that had us lean on Maine's report, which was done by an actuarial firm called NovaCare for quite a pretty penny. And we were able to apply US Census Bureau data that's specific to Colorado population to their methodologies to further project. That is how this report was done. And there are several steps. Again, it's not rocket science, but it does need to be done, carefully, cautiously, and reviewed various times over by various folks, just because there are lots of steps to it. And that's what we can offer our team. So by going through that report with me, I think the first step would be reaching out to myself. I put the email on that first page and CC Nicole so she can track at a national level who is utilizing this process. And we just kind of start to understand what the nuances of your bill is, because each bill is a little different, right? Ours is only applying to commercial payers, not including RISA plans or any private plans. And that's very different than some of the other states. And then also what type of devices, right? So Kyle's New Mexico bill is orthotics and prosthetics. Ours is just prosthetics. So that definitely changes how this needs to be analyzed. And then also the age range, to Peter's point. So all of those things we can help project with. It just going to take some time and some collaboration. I don't know, Kyle, if that helped illuminate the main points you were hoping for.
Absolutely. I think in short, team, I will tell you that she is probably one of the best individuals I've ever worked with to be able to help break down data. So I highly recommend working with Shanice on that. But the key things is every state is going to be different. So if you unfortunately are required in actuarial, I think this will suffice your ability to work in your initial committees. But thank you so much, Shanice, for teaching me. This was mind blowing.
Oh yeah, no problem. And thank you, Kyle.
Hi,
Just trying to
Shanice.
follow your guys' leads.
Hi, Shanice. This is Jim Kaiser in Illinois. Can you hear me?
I can. Hi, Jim.
No, I have to give a shout out to this young lady. She has been remarkable in, first of all, providing the financial and social impact statement to Illinois, and then scrubbing it with her colleague, Jana Montgomery, trying to put our data in from Illinois, which is sketchy, and comparing it to, the data that's already in there to come up with a per member per month, assessment for the cost. It's incredible what she has really done. I can't thank you enough, because I was stopped when I got to filling in some numbers, and then when you stepped in, it made sense again. So thank you.
Hey, no problem. And I think all of this really goes to say that I wouldn't have been able to do any of this without a lot of the folks on this call leading this initiative. Angela Montgomery and Jeff Keane from the Colorado State that brought me in as just someone who was interested in what they were doing. And my expertise served a purpose here, and I'm excited. But also Maine's study was really the predecessor here. And in short, to kind of summarize before I run out of time here, if I haven't already, Nicole, is this report took me, I would say probably at this point about 40 hours over the last month to create. And that's because it took, a lot of probably 4 or 5 big studies, doing a case review, adding what was pertinent to this, and then analyzing and summarizing. And I don't want y'all to have to go through that. I think that is something we should build off of each other. That's the whole purpose of not recreating the wheel. So I'm happy to help you reuse this and redraft it. So all you have to really do is plug and chug and not do what I did. I just ask that before you copy and start pasting, bring me in. And then we got to make sure that it's reviewed by the proper folks, including your legislative sponsors, your legal sponsors. There are some legal terms in here that we got to catch and vet. But all of those things are not impossible, and they're actually quite easy. So reach out.
Huge thank you, Shanice. I think you've been the missing piece of the puzzle, and just want to thank you so much for the time and expertise that you've brought through this report. And again, to reiterate to everyone, don't go to the Google Doc and take it and start running with it on your own. Like, you need Shanice behind the wheel, and you can be in the passenger seat type of thing. But Maggie, I know you raised your hand.
Thanks, Nicole, and thank you, Shanice. This is so helpful and such good work. I've just been thinking as we've been talking and based on previous conversations, it might be helpful for us to have a visual, maybe like a map, where we're showing per state that are working on these initiatives and in other states that already have an insurance fairness bill, like the slice of the pie, the number of patients that we're able to impact with the legislation, because as Shanice mentioned, it's not like in Colorado, it's just commercial payers, so that doesn't affect the Medicaid population. So it would just be helpful for us, I think, as a team, but also for some of the clinical providers to know what that slice of the pie is, and to have an easy way to kind of look at that or look that up, which I realize would require some work from this group, and I'm willing to help with that. But I think that might be a nice kind of one pager for us if we can put something like that together.
You're speaking my dashboarding language. So what I do for the state of Colorado is performance improvement. And I own a dashboard for all of our public health programs. And I think that's exactly where Nicole and I's brains were going, is what is the geographical makeup of who's impacted, what the cost is that this report can help really calculate. But then also, what are some of the metrics, clinically speaking, that we can put in front of our teams as these start to become real initiatives that we start collecting to further project down the line of the outcomes, right? So like a year from now, when we want to do Medicaid, for example, spoiler alert, I selfishly want that. I'm sure a lot of people do. How can we start to set ourselves up for that? So I know Nicole has heard that plug from me, and I'm so happy you said that. She's taking the initiative on bringing that group together. So Nicole, I'll let you take next steps on that, but I can definitely help give you that data when we start working on these reports for that dashboard.
Absolutely. I love the idea of having a visual, and I think that will help us from fundraising purposes as well, to be able to say, you know, who is this impacting and what more of the population we need to be able to bring into this, and how funding will help us be able to target populations that are under Medicaid as well. Fantastic. All right, so we've got 9 minutes left, and according to my agenda, we're supposed to have 25. So, you know, we've been very talkative, but we've been, you know, had some really great content here. So as the Madam Chair or Mr. Chair would do, they're going to limit, you know, you to 1 minute testimonies moving forward. So I really want to celebrate now the states and all the work that you guys have been doing. And there's been some incredible wins over the past few months, and want to give you all the opportunity in 1 minute to share an update and to celebrate that win. So Francois from Arkansas is, I believe, was not able to come today because he's on vacation, spring break with his family. So I'm going to pass it off to Jeff Kane in Colorado.
Thanks. I'm subbing for Angela Montgomery, who's the other co-chair. Colorado introduced So Colorado Kids Can Move, initially for kids only, with the AOPA Insight. Our sponsor, who is a person with a disability, said, no way is he going to have a bill that could be discriminatory. So we changed to an all ages bill. That's a lot of work, guys. It means updating your sponsors, your fact sheets. Shanice did a heck of a lot of work, and you can't have her because we have mountains and she's a mountain biker. So we were able to get our sponsors to update it. We were in the health insurance committee this last week, and we passed out our key spokesperson. We've already been admitted to as Braden, who is 5 years old, and he knocked him dead. We're unanimous support out of that committee, and we're on our way to Appropriations Committee. That's the quick and dirty. How'd we do timing?
Fantastic. I think the best. Absolutely. Thank you so much, Jeff. Is wonderful. And applause to you all for your continued efforts in Colorado. All right, Jim Kaiser in Illinois, you're up. And Bucola as well.
Okay, I'll just say a couple of things, and then let Bucola mention it. I think we've done well. We have, this is an amendment to our Insurance Fairness Act. We've had no resistance from anybody in the insurance industry. The Illinois Department of Insurance has taken a neutral stance on it, so we don't have any resistance there. We've passed through the Senate Insurance Committee with I think 100% bipartisan support. It's right now in the Senate for a full vote next week, which we anticipate it will be probably 100% full support. It is moved into the House right now in Illinois, and Bucola, you're in Springfield. What are we doing today?
So thank you, Jim. Hi, everyone. The Senate just adjourned not too long ago, but happy to report that Senate Bill 2195 is on the consent calendar, which means that it has full support from all of the Republicans and the Democrats, and it will sail through to the House. Our companion bill, House Bill 3036, I believe, has not moved because they are waiting on the Senate version to come over. And both members on both sides should be able to sign on and support. On the Senate side, we have at least 3 members in leadership who have signed on as co-sponsors. So everyone is looking at the bill favorably, and it's going to be really exciting to get it to the governor's desk.
Excellent.
There we go.
Fantastic. Great work, Illinois, and just really helpful to hear, you know, how things are, the feedback from insurance companies, Department of Insurance, and just the bipartisan nature of what you guys are doing too. Great job. All right, Eric, Indiana. Is Eric still on the call? We might have dropped him at some point. All right, I'm going to pass it off to New Mexico. Kyle and Laura.
Awesome. Thank you so much, Nicole. It's been an honor working with Laura. Our key spokespeople was Callaway and Hope. They're the reason why we ended up finishing strong in the Senate. So we ended up passing through our second chamber in the past couple of weeks, and it's going to be signed into law. We got confirmed that the governor will be signing the legislation, and she has until April 8th. To sign the legislation. So we are just waiting back on their schedule, and we will be having a ceremonial signing. Laura, I would love for you to add anything.
I would just encourage you, like everyone already has, like bring your personal stories, bring what it means to you personally. If you're presenting a personal story and it means something to you, it will mean something to someone else. And like Kyle said, Kyle was there, Callaway is there, Hope is there, everybody that was there, like could have brought a box of Kleenex, like that's what you need to do. There was one representative that said, he said, I'm known as the Grinch. I'm like the Grinch here, but after Callaway and Hope spoke, my heart grew 3 sizes today. So I would say make that your goal.
Absolutely. And as I've been watching the testimonies, I'm over here bawling my eyes out behind my computer. So I'm gonna have to get like a perpetual box of Kleenexes. So amazing work to New Mexico and congratulations. I skipped over New Hampshire because I believe Senator Prentice had to jump off, but Maggie, did you want to say anything for New Hampshire?
Sure. Yeah, I'm not directly in New Hampshire, so I'm not as knowledgeable, obviously, as Sue is about their whole process, but I'm just going to read to you what she had sent me recently, which is that we're held in committee for the insurance mandate review. She said, I'm holding off on the pre-auth amendment until the review comes back. It's going to be the same bill number and the same stakeholders at the table through the process, but which will start up again in the summer. It's good news. She thinks we have a real chance, but it's going to take till 2024 to get the final vote. So that's the current status. And in New Hampshire is also one that has insurance fairness in place. So we're building off of the current law.
Fantastic. Thanks for that update, and huge thanks to Sue, Senator Prentice, for her efforts in New Hampshire. Okay, and then the last two that we have on here, Oregon and Tennessee, they don't currently have physical activity language in the bill, but Oregon is working on an insurance fairness bill that had been passed in 2007. It sunset in 2017 because of the sunset clause. And so I want to pass it over to Sarah May and Dee, who are leading the effort on the ground in Oregon.
Hey guys, yeah, like Nicole said, we testified recently in front of the Senate Healthcare Committee to get insurance fairness reinstated as it had sunsetted. We passed off that. We've just passed the Senate floor, I believe at 28-0 unanimously, and it's headed to the House next, where we will likely get to testify. It was an awesome supportive committee. We did have one Republican senator who seemed worried about the associated costs and not wanting to tell insurance companies what to do. And I think, as Nicole made a good point, they can sensationalize the awesome technologies that are happening. And so I think he just has a little concern that there will be astronomical costs associated potentially, that we want to do like a little show and tell and connect with them further. But we're having really good momentum, and our goal is to jump on board and get the athletic prosthetics and orthotics included next year, 2024. And Dee, if there's anything you want to add.
Awesome. That's great. And yes, Senator Gelser-Bluen, who's the sponsor, has already confirmed that she would love to introduce a bill next year with the physical activity side of it as well. All right. Last but not least is Tennessee. Joshua, if you're still on the call, would love a quick update from Tennessee.
Yeah, absolutely. So yes, there had already been prosthetic language introduced in the prior legislative session. We have decided that it is politically best to try to co-opt and use friendly amendments to try to get that through. However, based on where all of this was going, I think Tennessee is probably the most fiscally conservative and probably otherwise conservative state on anyone who is making these efforts right now. So we know it's an uphill push. We are excited that Arkansas has made such great progress as a contiguous state, so we can show parallel things and try to have some model language from a state that Tennessee would not reject them out of hand. We do have a lot of children and adults who I think would be very interested in helping out and telling their own personal stories. The final thing I would add to the previous discussion on branding and everything else, one strategic advantage we probably would be pushing for children first, and structuring that where adults will be perceived as advocating for others rather than advocating for additional benefits for themselves, where they can say, hey, can we at least take care of the kids? We think that would be beneficial in getting our state legislators to consider this.
Awesome. Thanks so much, Josh, for that update in Tennessee and kind of the background there in terms of your political climate and also the idea of being able to look to, neighboring states and using those as examples moving forward. And for those of you who are on here from other states that haven't yet introduced legislation, we're excited to continue working with you all and give you a voice in the room. We might have to extend our calls a little bit longer because we are at time now. Just the last thing we want to do is plug the Amputee Coalition's advocacy webinars that are coming up in April. Whitney Doyle has put that into the chat. Sam Miller has also put in AOPA's policy forum that's coming up May 10th through 11th. Would love to have you guys with us in DC for that. And the last thing is that, as I had mentioned, Dr. Susanna Ingdahl, she's actually working on a survey, a barrier survey, to help us better understand the limb loss and limb difference communities' challenges to gaining access to this and being able to publish or create and share results from a survey to be able to share that data more specifically. And so one of the things that she's in need of is a CPO that can help review a couple questions in terms of how they're currently phrased. So if any of you are interested in helping to dive into just a couple questions that she has in that survey to make sure that it's being received well from an individual who's taking it as a person of limb loss or limb difference, we would love your help on that. So either drop that into the chat or send me an email if you're interested in participating or helping on that. The last thing I want to do is, if we can, take a picture of this group again, because we've got so many incredible people here. If you're willing to put your camera back on for this last little photo op, we would love to do that and have some big smiles from the group. Cool, I'll give everyone a couple seconds. I'll get my handy dandy screenshot grabber here ready. And I think everyone's been given the time, so I'm gonna do it. And all right, ready? 3, 2, 1. All right, I got you all. Sorry, that took longer. That's like my grandpa taking a photo. All right, well, does anyone have any last questions or comments that you guys would like to share, that if you haven't already? And if you have to go, feel free to jump off. That's the end of our call. But we're willing to stay on here and address anything else that anyone wanted to bring up.
Nicole, I just had a question about the policy forum. Obviously, we're working on federal legislation for that, but are we going to be talking about So Kids Can Move during those sessions as well?
Yeah, absolutely. We're going to be having a So Kids Can Move panel as part of the policy forum, and Kyle Stepp is actually going to be our keynote speaker at that event. So we're definitely including state-based efforts in the discussions for policy forum. So we'd love for people who are interested in getting more involved with that. But overall, the policy forum is focused on our federal legislation. And Sam, feel free to add any additional thoughts on that.
Yeah, I was about to say, we're also going to do our state reps meeting for the second quarter during the policy forum too. So there'll be a little bit of state mixed in with the federal.
Excellent. Thank you.
Awesome. Any other thoughts, questions from anyone? Great. Thank you all for being here. Thank you all for the work that you guys are doing. We're excited to continue moving this forward. One of the last things that I just wanted to mention is that we're continuously building this roadmap and kind of learning along the way. And that's definitely something we will be reaching out to all of you to gain better feedback from about this process and how we can make it better moving forward and continue to build that roadmap so that every state has a good experience and can get the technical assistance and information that they need. Great. All right. Thanks, everyone. It's the Minnesota goodbye again. Terry, you know what I'm talking about.
Thanks, all.
Yeah, I sure do, Nicole. Goodbye. Goodbye, goodbye,
everybody.
Bye.